new cases of cancer annually in Nigeria, and more than 80,000 deaths annually. And this is mostly hospital-based studies, because some of the patients that die in the rural areas that's unreported are not captured by this data. So, this data means that previously this figure were lower, but it means that there's a rising incidence of cancer and increasing mortality. Even though there's more awareness and even treatment opportunity, improvement in treatment opportunities, but it still shows that the cancer incidence is on increase. So creating the need for awareness and treatment and follow-up. So I'm very happy that you are here to create that awareness and to let the people know that cancer is not a death sentence, but something that you can detect early enough and intervene appropriately by using a number of experts. And I want to tell you that the number of experts, number of radiation and clinical oncologists who are experts in cancer are increasing in Nigeria. So the ACON statistics, that is the Association for Radiation and Clinical Oncology of Nigeria, is showing a significant number of specialists. Though we still have a lot of people migrating to the outside country, depleting the figure, but it is no longer what it used to be before, where you have less than 50 people, 50 specialists, but now they can now be up to 100. So, but this 100 is inadequate, looking at the population of Nigeria, which is over 230 million. So it's almost inadequate. So the population size, you see that we need more hands on the deck in order to help reduce this cancer scourge. Then coming back to breast cancer is the most common female cancers in Nigeria, and almost the same worldwide, apart from lung cancer that is almost neck to neck with it. But some statistics have shown that breast cancer is more widely in a lot of countries, and in Nigeria is the most common cancer and most common cause of cancer death in Nigeria, because of the higher incidence and the higher mortality. And also some people are still not actually aware of that the disease they are carrying is breast cancer. So the awareness is still, though high, but still insignificant compared to what we are seeing in the hospital because of increasing number. It means that if these people are still coming in large number, then we need to do something in terms of creating more awareness, creating more places for treatment, getting more experts on the way, and giving a lot of training opportunities for people, and giving others a level playing ground, like NGOs, that non-governmental organization, to go down to the hinterland to disseminate information about some of these cancers.
Cervical cancer. What is it? What is it?
Okay. Cervical cancer is a cancer of the neck of the womb of a woman. Neck of the womb of a woman is called the cervix, and it's the second most common cancer in Nigeria and the fourth globally. And it's a preventable cancer. When I say it's preventable cancer, it's a cancer that even the World Health Organization is targeting for its elimination, because it has a causative organism. It has something that causes it, and what causes is a virus, which they call human papillomavirus. And the good news is that we have vaccine in which, if given, can prevent people from developing cervical cancer and cut off the epidemiological chain. That's the way it spreads, the way it gets away. So, and it's a disease that's more common among low socioeconomic group and those who are poorly informed. in terms of sexual relationship and about awareness of these vaccines. So for societies that are maybe highly high income country or advanced country that have undergone wide vaccination of this against this cancer, you see a low incidence. But for some of us who are in the low and middle income countries, we still have high incidence because of the low vaccine uptake and even awareness. Sometimes we have a lot of argument whether the vaccine is not harmful, or whether the vaccine is safe, whether the vaccine is not being used to reduce population or to reduce the fertility of a woman or the other, or the man. So you see a lot of argument going to and fro. So you need a lot of information dissemination to talk about the importance of that vaccine, that it is the pathway in which cervical cancer can be eliminated. And I said it's an eliminatable cancer, and World Health has targeted 2030, that 2030, as a year apportioned for almost elimination of cervical cancer, especially in low and middle income countries of the world. And good thing again is that Nigeria Immunization Technical Advisory Group have equally approved this vaccine, human papillomavirus vaccine, for general use. So it's now in various hospitals and various local government health centers, so that women and children and young adolescent children can now have access to these vaccines and make sure that we're able to meet the target, World Health target of 2030, which is almost very near.
Thank you, Doctor. Can we also look at prostate cancer?
Okay. Well, prostate cancer is the most common male cancers in Nigeria, and is a cancer that after the breast is another cancer that we see that is very, very common and has high mortality, especially for men. One of the things about prostate cancer is it is almost age-related and is more severe in the black compared to the white. In terms of age of occurrence, it occurs earlier in the male and than in the blacks than in the whites. And sometimes there may be genetic predisposition in which it goes through a family tree, whereby a father died of prostate cancer, the son later had a prostate cancer, and another one of the sons had. So you can equally look at their gene line to know if they are harboring the gene that promotes this prostate cancer. So it's a disease that if you're able to do what we call screening, or what we call early detection, you can actually nip it in the bud, and there's already available treatment modalities, and experts are there, including urologists and radiation oncologists, including radiologists who are going to do a lot of imaging, and including pathologists who are going to do the diagnosis in terms of looking at the tissue sample taken by urologists to confirm if there's cancer or not. So these are the things that if the cancer is detected earlier, I will assure you it's one of the diseases that one of the cancer is curable. But if it's in advanced stage, it's always a big challenge because it has pre-deletion, or it has the ability to spread to the bones and to the visceral organs. And the visceral organs, I mean the liver and the lungs. So at that point, it's become very difficult to cure. And most of the patients present at this stage, and that's why it looks like to say that prostate cancer is not curable. In our setting, the awareness is still poor, and people's belief system is still affecting people uptake of some of the treatment modalities that are being suggested to them. Some see it as a witchcraft, some see it as somebody have sent it, that need to take it back to them. Some see it as something that you have to sit down in your house, start praying. Some equally go about drinking all kind of manner of concoction But we are now preaching and encouraging people to prostate cancer, if detected early, you can live the number of years that your creator have given you.